Hey guys, Holden here, H-Bomb Fitness. I'm in my bathroom right now because I couldn't find a wall that had the right height to film this video. So it worked down here. So this is what we're going to do. Um, Above your knee, there's a tendon called your quadricep tendon. Okay, so this tendon gets loaded basically during a lot of different movements. As simply as walking, then we got jumping, running, the list goes on, squatting. So this tendon gets loaded because the quadricep will get put on a stretch, as in going down into a squat, and then get put back on tension when it's coming up from the squat. And basically what it does, the tendon, is it helps control the patellar bone, helps the tracking of it because it pulls on it from the quads. Okay, so this thing gets really tacked down, a lot of pressure is on it. So this is what we're going to do. We are going to go after the tendon itself. We're not going to worry about the musculature around it. However, this exercise does help with that a lot. But we're just going to focus on the tendon and go after the fascial restrictions around the tendon, okay? And then actually go after the collagen itself and try and break up the adhesions by doing a perpendicular friction to it. This is what we're going to do. You're going to go up to a wall, okay? Actually doing it on the counter is better because you can just get a different amount of pressure. But what we're going to do is stick the ball right above your patella, and then you're going to use your whole body weight to just drive your knee into the ball. Okay, the nice thing about this is you can get a lot more pressure than laying on the ground, and you have a lot more control because you're just driving your knee left and right. Oh, there's my dogs. So you're just going to drive your knee in. You take up the slack by kind of twisting the ball. And what we're doing here is just some cross friction with an immense amount of pressure. I mean, you can just put your whole body weight, use your back leg, and use your knee to just drive this in. So this is nice because we're doing some perpendicular friction to it and breaking up some of those collagen fibers in the tendon itself. And tendons and ligaments aren't stretchy, you know. So our goal here is not to try and lengthen, which is pretty much impossible. We're just trying to break up the adhesions and the fascial restrictions. So, the musculature and the patella bone itself will be, more pliable. Okay, so once you do that, then next thing, you do a thing called tack and floss. You press down and lift up that back leg. Okay, and what this is doing is you're kind of holding on to some fascia right there and just pulling it through. And you can just scour around and just find it, pull it through. Okay, so I've never really seen this exercise before. I just was kind of messing around with this, and this thing is amazing. Honestly, it's way better than doing it on the ground, I think, and you just get so much pressure. Okay, last thing. Move this camera around. You guys can see this. Okay. Last thing. You're going to take the ball itself, okay, and put it on your tendon. And the difference with this is not so much, getting pressure through this. We're just trying to take up the slack by taking this lacrosse ball, which is grippy, putting it right on the tendon, twisting the ball, so we're taking up the slack, grabbing all that fascia, okay, and then from here we can do some movements with our leg. It's better if you're on like a little higher surface, so you can kind of get more pressure, but you're just trying to pick up the spots and just glide it through. Okay, basically you're just holding onto that fascia and putting it through a stretch. So it's a little different than like going after the musculature. We're trying to go after the fascia, which covers the muscle. And then last thing after you do that is just find the tendon, and from here you're just going to do some perpendicular cross friction movements. Okay, And what that's doing is it's, we're going against the parallel tendon, and we're driving some friction onto it, and we can break up those adhesions and actually promote some, genesis of some new collagen throughout this tendon. That's how kind of tendons repair is, obviously with strength training and building stronger tendons, but if we can kind of break up those adhesions, we get some blood flow into there, nutrients, and things kind of get started. So there you go, guys. That's a video just on the quadricep tendon itself. So thanks, guys. See you.